Hey everyone, Dr. Dale here. Real quick, I want to talk to you about a different type of spinal fusion, actually neck fusions or cervical fusions. And this comes from the Journal of Spine from 2002, and I'm going to read it to you and then we're going to talk about it. The conclusions were, and this is when they compared spinal fusion patients, those who underwent the surgery, and those patients with the similar conditions who chose not to go through the surgery. When they compared the patients, workers' compensation patients with chronic disabling work-related cervical spine disorders who underwent fusion have socioeconomic outcomes after surgery statistically similar to those unoperated controls. Surgery patients had a higher rate of additional healthcare seeking behaviors from new providers and a greater likelihood of being clinically depressed before and after rehabilitation. So let's talk about that real quick. If you got the fusion, you're more likely you were no better off than not doing the surgery. But also, you would have a higher rate of additional healthcare seeking behaviors. That, to me, common sense thing, I think they probably had more health or poor health outcomes, meaning they needed more drugs, more medical intervention, those things, because they went through the surgery. Now, let's talk specifically, and maybe this is you out there, and it's very well documented that injuries to the neck, injuries to the cervical spine can cause depression, anxiety, and mental conditions, or mental disease, we'll say. Why would it be so prevalent in those people who undergo spinal fusion? It's simple. When you undergo a spinal fusion, you stop any mechanical movement in your neck. And what I think about here is the fact that our neck has some of the highest amounts of mechanoreceptors. That's basically nerve receptors for mechanical movement. So when we move, any type of movement, especially up here in our neck, we stimulate a great deal of electrical stimulation to our brains. And funny enough, areas that are stimulated by movement of our body, especially movement of the neck, are areas of the brain that control emotional and logical thought processes. So by fusing the spine, we stop all of that. We stop all that mechanical stimulation, all that electrical stimulation. And there was once a Nobel Prize winner, I forgot his name, but he said that almost 90% of nutrition to your brain is the movement of your body. This is why movement is critical. And so what I want to do here is, number one, if you're thinking about having that fusion, I beg you, don't do it. Seek the care of a maximized living doctor. Allow them to take a look on x-ray if they can begin to mobilize your spine and allow those tissues to heal. Do adjustments on your spine very specifically to take pressure off that disc and maybe fix that herniated disc, which can happen. I've seen it many a times. Also, by improving the movement, the spinal structure and tissues can heal. And also you increase that neurological stimulation to the brain to improve brain health. So seek the care of a maximized living doctor. And also I want to say to those out there that are listening to this who have had the spinal fusion, we can still help. I've done an extensive amount of additional training in like Clear Institute and along with Maximized Living to look at very serious spinal conditions. I've done a lot of work with post-surgicals, meaning a lot of people have already had the surgeries and the fusions. And the fact is, one of my staff members has fusions in her spine. She actually has rods from scoliosis surgery from about here to here, from I think roughly T2 to L2, and we still adjust her. And she's been able to get off of every single one of her depression medications, migraine medications, and even hormone medications. Simply put, we adjust above and below where those fusions are. We're not going to adjust into the fusion. And by increasing mechanical stimulation, mechanical movement, and proper alignment of the spine, we will increase your health and your mental health. And I've seen it hundreds of times. So use common sense here. Which would you rather? Something that fuses the spine, eliminates all movement, that eliminates electrical stimulation in the brain, or go to somebody who can actually improve the mechanical movement of your spine and improve your overall health. So what makes common sense? You be the judge.